Alcoholism in boys and adolescents under the age of 18 is called early onset alcoholism. It's called early onset because it's believed that the clinical course of alcoholism in children is more malignant than in adults. What is this related to? Often, after experiencing trauma or after suffering from neuroinfections, children develop alcoholism. They become somewhat psychopathic. At a young age, the development of the central nervous system happens very aggressively. It is highly vulnerable to the effects of ethanol. Such children become, let's say, socially maladjusted very early on. They develop their abstract intellectual thinking is impaired, and their memory is affected. Alcohol intoxication in children is quite severe. After a period of agitation, they then fall into a medicated sleep. Seizure activity is possible, and very often there are fatal outcomes. The background that predisposes children and adolescents to alcohol use is very important. First and foremost, this is psychopathy. It can also be the loss of a father or mother during childhood. It could be a family where there is drinking or frequent conflicts at home. All of this piles up and leads to children trying to cope with these negative experiences through alcohol use. Such children become unruly, they become educationally and socially maladjusted. They may even develop sexual promiscuity. This is, let's say, a serious situation that requires attention not only from the family, but also from specialists who work with this category of patients. One of the ways to combat not only childhood alcoholism, but also, naturally, everything that starts in childhood and then carries over into adulthood, where already formed personalities with certain premorbid traits, of course, go through life and end up in addiction clinics. First and foremost, this is prevention. Prevention involves holding informational talks, meetings, and events where psychologists and doctors clearly and professionally explain the harm that alcohol and drugs do to the body, as well as the consequences that await a child or a family where such a child is present. The goal is to stop and eliminate the problem at its root in advance, as they say, before it grows into a much more serious illness.